Elarigo Namaskara, Dr. Sushma Hosur here, your neighborhood medical genie. I'm an intern at Wuhan University School of Medicine, China. Today, I'm shooting this video in Wuhan. I have reached my city safe and sound by God's grace and all your blessings and prayers. So I really hope those who are traveling to China or have reached a certain stage of quarantine, hope you guys are safe and sound as well and have reached your respective cities. Fmge exam is conducted on December 4th, 2022. You guys have exactly 30 days from today. And I'm sure you all are in a pressure cooker situation. So was I a few months ago. I totally understand and I empathize with you guys. It's an emotional turmoil, a lot of frustration, anxiety, etc. But trust me when I say this, it is just a phase and this too shall pass. You've gone through a lot and you've been so strong all this time. It's a matter of another 30 days. You either make it or you break it. That's how it works from here. It's easy to actually succumb into negative loop and say, okay, let me just do it next year, or maybe next exam is postponed now, so let me try it again. The exam would be conducted next year as well. I will prepare better, I'll have more time to study, I will execute so and so plan. No, stop making excuses in case your brain has already started inputting these kind of thoughts. It is a big no to it. You have gone through a lot, you have been so strong, and I know I'm reiterating this fact, but do not let your mind play with you at this point of time. In today's video, I shall be sharing the strategies which I implemented in the month of May 2022, which helped me secure a score of 202 in my very first attempt. So let's get started. I am sure by now all of you would have completed one round of revision and probably most of you have even started subject-wise tests. Those who missed NLC and other coaching classes who have already provided you with the schedule, please stick to it and you're good to go. Those who are using prep ladder marrow, you require an external pressure, motivation. So what I would suggest is that jot down a plan, a reasonable plan which you can execute. Spend 40 minutes today just to come up with a plan. Please do not follow anybody else. Everybody is different. You can probably take few ideas from here and there, but make sure your plan is something you can execute and not unreasonable, because the minute it's unreasonable, you will go to bed unsatisfied every single day and that will just ruin the next day. So it becomes a vicious cycle. So this is the revision schedule which I used back in 2022 May, and I would like to share it with you guys. If you think it's feasible, if you think you like it, then go ahead with it. Otherwise, you can use the same idea or similar idea and then create a new timetable for yourself. So your second round of revision, it is to be completed within 15 days. I will jot down this plan and post it on Instagram as well. So right now I will be explaining it orally so that you will understand, get a brief idea of it. But in Instagram, I will be sharing the entire timetable which I used. So let's get started. Dedicate one day each for PSM, Obs-Gynae, medicine and surgery. Not more than that. You need to spend at least 18 hours. I would suggest 18 hours, 16 to 18 hours for these 4 subjects, and spend an entire day for it. The rest, I think with the second round of revision, you would be more confident. In your first round of revision, I'm sure all of you would have highlighted important points, jotted down on sticky notes and probably pasted it all over your walls. So it gets easier for second round of revision. 4 days for 4 major subjects which would actually constitute the major chunk in your exam. That is PSM, Obs-Gynae, medicine and surgery. Now you're left with 11 days. So 1 day for anesthesia, ortho and radiology. Radiology is more of an image-based question and also comes in an integrated session. So I would not suggest you to spend a lot of time on it because it's just image-based. You will find an integration of radiology in surgery, medicine and orthopedics. So it's easier, it becomes easier. You just have to skim through those images as many times as possible, and theory, just go through old papers and probably the topics around it. That's what I did and that's what I would suggest. 1 day for FSM, that is forensic medicine and psychiatry. To dedicate one entire day for pathology, especially hemat section. Hematology, it is a bit difficult. I found it a bit difficult. A lot of things to remember. So I would ask you to spend quite a lot of time on hematology because we had around 2 to 3 questions in June 2022 exam. So it is quite an important topic. But that does not mean you neglect the rest of it. Go through the rest, but pay more importance to hematology. 2 days for anatomy and physiology. Spend more time for anatomy rather than physiology. Physiology also comes as an integrated question. It's very rare that they ask direct questions. Last time it was just 1 or 2 with a direct question. The rest was more of an integrated type of question. So anatomy, you will have to go through it quite some time because it's a very vague and dry subject. It's very evaporative in nature, so please go through it thoroughly, especially the images. Images are important. 1 or 2 questions were repeat last time, so you never know. If you're lucky enough, you might get around 3 to 4 questions which are repeat, but the concepts are same, so that's the best part. If you know the concepts, you can definitely crack any exam. 1 day for ENT, 1 day for opthal, 1 day for pediatrics. Biochemistry, 1 day. Again, it's a very evaporative subject. You will have to go through it day in and day out. What I did for biochemistry was going through a lot of MCQs rather than just sitting and studying. I will be linking all the Telegram groups which I use for solving MCQs down below in the description box. Please do check it out. It helped me a lot. I'm pretty sure it will help you guys as well. So what I would suggest for biochemistry is you have those sticky notes, you have A4 size sheets. Jot down, scribble down important points and paste it. You have to go through it every single day because it's so evaporative. The next day, at least for me, it was very evaporative. The next day, I used to forget whatever I had studied. I never personally really liked biochemistry. It was not a lot of questions this time. It mainly came in paper 1 and it was more conceptual and application oriented rather than just ratamar and vomiting on the paper. So you will have to know the concepts. You'll have to know the cycles, ornithine cycle, all of that, Krebs cycle. You need to know. I'm not saying every single thing, but you need to have a brief idea about it. It will be great if you can remember all these cycles because you never know how the paper is going to be. So it can be a direct question, it can be an indirect question. So it's better to know these cycles. Last 2 days left. 1 day is for derma, or maybe half a day for derma. 1.5 days, I would suggest you to keep those days only for revising topics which are more evaporative, or in case you haven't been able to complete certain topics, then yes, keep those topics on those 1.5 days. Now you're wondering why I left out microbiology and pharmacology. I did not. I studied these 2 subjects in a very different way. I did not spend one entire day just for them. What I did was I split the subject into different chunks and I studied it on daily basis because I personally found it content heavy and a tad more difficult compared to other subjects. So for example, let's say I did anticholinergics today. Tomorrow I have planned to do beta blockers from cardiology. So day 1 it's anticholinergics, day 2 is anticholinergics plus beta blockers. So that's how you add on. After 15 days you will be thorough with microbiome and pharmacology. You will know the uses, you will know the side effects of every drug because you are revising it on daily basis. So what I did was I spent 1 hour on micro, 1 hour on pharmacology every single day, and that's it. By the end of 15th day I was done with these 2 subjects, and honestly I could visualize these images, the textbook images or my notes on the day of exam. So it became a visual memory for me rather than just passive reading. When I say revision, it is not passively reading. Please do not mistake it. Now, revision has to be always active. What do I mean by active revision? When I read a page of PSM or whatever, that should be imprinted in my mind, right? That's what I meant. When I read a page, I close the book and I should be able to produce as much data as possible without looking at it. So the more number of times you put pressure on your brain to recall things, your nervous connections get stronger and your memory gets better. That's how it works. Do not just keep reading it. It's not about reading. It is about active revision, and that makes a difference. If you keep reading it, no matter what, you'll not be able to recall on the day of exam. Now, the next 5 days is your third round of revision. When I say third round of revision, it is just going through your highlighted points when you have marked in your first and second round of revision. That's extremely important. Use different colors. You get a lot of highlighters, a lot of color pens. Make it attractive so that you would actually want to study. Apart from highlighted points, you need to go through weaker sections of different topics in all the 19 subjects. because your weaker sections are something you would want to avoid for the most part. For example, let's say vaccination and PSM. It's difficult to memorize, right? And it's a very, very important topic. We had around 2 to 3 questions in the month of June 2022 exam. Very straightforward, easy questions. So it's something you can actually crack. I would say jot it down, scribble it on a piece of paper. You don't have to produce a beautiful birthday card here. Muscle memory plays an important role, and you will understand the importance of it on the day of exam. So scribble things down you don't know. It does not have to be neat. Nobody has to understand. Along with your third revision, I want you to spend at least 2 to 3 hours whenever you feel exhausted, start solving MCQs. So I would actually suggest that in the beginning itself. I'm pretty sure all of you would have even started solving the MCQs, so I'm not quite worried about it, but make sure you're more consistent from now. So I would send you the links down in the description box of Telegram groups which I used, and it helped me a lot. Follow them on daily basis. Apart from solving MCQs on Telegram groups, I would really recommend you to start answering on the Unacademy live YouTube sessions. I think they've started for NEET PG already. I use for NEET PG. It doesn't matter because Fmge and NEET PG are of almost the same level now. So I would want you to answer, not just watch the video. You might think it's a waste of time. Go for live sessions and not record it, because in live sessions you can answer it. For the most part, they will actually respond to your answers. If you're right, they will appreciate you, which will give you more confidence. If you're wrong, they will rectify it, and they'll even explain the concept behind it. So I think it's going to be the same for MIST, Prep Ladder, doc tutorials, Unacademy. I mainly use Unacademy live session videos. I think in the second month of my preparation. Apart from that, I did missed 25 questions. Prep Ladder, I did not have much time for it. Doc tutorials I did for anatomy, ENT, and ophthalmology. So yeah, if you can go ahead with any of these things, it's totally up to you. You can use a combo of many YouTube videos, but I would suggest a live session rather than a recorded session. For the next 5 days, I want you to solve GTs, those with Prep Ladder, Marrow, all those different educational apps. Please start solving GTs. I'm pretty sure most of you would have even started before, but right now it is the time. Do not keep it in the end thinking, okay, chalo, let me finish studying, let me finish all the revisions, let me do another round of revision and then start. Because sometimes the scores you will get in these apps would not be satisfactory. Sometimes you'll miss out by 2-3 points just to reach just pass, because these Q banks are supposed to be very difficult. So once you actually get the hang of solving these MCQs, it's going to be a cakewalk. When I say solve GTs, make sure you know where you're going wrong, understand the concept of the questions you've gone wrong, analyze if it's conceptual mistake or is it memory based mistake. So based on that, work on it. Analysis plays a huge role. If it's conceptual, then you need to know how to think, how to approach these MCQs. But if it is memory, that means you can't recall at that point of time, then you'll have to work hard on retrieving the information from your long-term memory. It's very important. Along with your GTs, I would want you to solve the past 3 years papers of INI-CET, NEET PG and Fmge. INI-CET, I know it's of a very high level, but it will teach you how to crack conceptual questions. It will teach you how to approach certain MCQs, which is actually seen in the recent Fmge papers. So it's not always about solving NEET PG papers or Fmge papers. You have to try a harder level, prepare for the toughest so that you know you're confident enough and you do not mess up, or you're not very anxious in the examination hall because you know how to solve these questions. INI-CET papers, they help you understand questions conceptually. It'll help you crack the paper conceptually. The approach towards these questions are very different. So I'm not saying all the papers, maybe at least 1 or 2 years papers for INI-CET should be more than enough. And do not worry if you don't score well, or if you're not able to answer a lot of questions. It's absolutely fine. I myself couldn't answer a lot of questions. If you can answer, well and good, but the learning point is that it will teach you how to approach the MCQs, which is required in your examination hall. What I would suggest is to go through volatile content like biochem, PSM, ANAT, etc. Whichever you think you can't remember, you can't recall, you're having a problem with it. Just go through the highlighted points and not the entire subject. I am reiterating the fact that do not go through the entire subject. It was a mistake I made. It consumes a lot of time. Firstly, you can't go through every sentence. That's not how it works. So please learn from my mistakes. I want you to go through only volatile content. Whichever subjects you feel it is difficult and you need to go through, only those subjects and topics, please go through it and nothing else. Along with that, go through the PYQs, especially NEET PG and Fmge, the questions you got wrong while solving them. Go through those concepts, go through those topics. It's all important because topics and concepts are always repeated if not for questions. Now it finally comes to your last day, December 3rd, 2022. I'm sure all of you would be extremely stressed out. It's okay, take a deep breath in and start the day like any other normal day. I know it's very difficult to think about it as a normal day, but you have to. But you need to stay as calm as possible because you can retain and reproduce better. That is the entire agenda of this exam. You need to be able to retain, recall, and reproduce on the paper. Nothing else. So what I would suggest and what I did was the first half of the day, just go through images, all the important images, especially ANAT, PSM, patho images, all of that. Go through it, do it 2-3 times so that it actually stays in your head. The second half of the day, eat well, talk to your friends, talk to your family, go out for a walk, maybe just go out for a cup of ice cream, whatever you want, but do not touch your books. It will just increase your anxiety. I do not want anybody touching your books in the last minute, till the last minute. It does not work. Whatever has to happen has happened. You have done your best. You can't change anything else by studying in the last minute. That really doesn't work. Your brain is already in a pressure cooker. So let it calm down, let it rest for a while so that you can actually crack the exam on December 4, 2022. I am pretty sure all of you would be able to do it. If you prepare well, if you execute well, nothing can stop you. You all are unstoppable. You've been through so much. It's not easy to go abroad, study at such a young age, but you all have been through so much. The weather changes, food, language, everything matters. So when you have gone through that, this is just another 30 days. You can definitely go through it and crack the exam. Big note to social media. Firstly, if you're still on Instagram, FB, Netflix, Prime, please get out of it. It is not helping you to relax during your break times. In fact, it's consuming more energy. You need to use your brain energy and spend it wisely over here. Make every minute count at this point of time because 30 days can be a game changer. At this point of time, you don't need these things. You think it is something that it's a leisure activity which will help you recoup from your stressful day. No, it doesn't. It just doesn't help. I personally was out of all sort of social media, any instant gratification tools for almost 10 months. Environment plays a huge role in this. You need to make sure you're surrounded by positive environment because at this point of time, everybody becomes very vulnerable due to a lot of stress which we are carrying. There's a lot of anxiety. So it's very obvious there's a lot of emotional turbulence within us, loss of self-confidence at times. So at this point of time, I would suggest that you should be surrounded by a positive environment, especially family and friends. For me, if not for them, I don't think I would have even gotten through this phase. It's very normal. Don't think it's abnormal. Don't believe that this is something only you are experiencing. You can talk to anybody you want. Every person in your situation would be experiencing the same thing. So do not worry. It's a very normal thing. So make sure you're surrounded by positive environment. Another thing is that don't let your mind control you. The minute you start allowing your mind to control you, that's it. Things will start going south. You need to learn how to control your mind, your thoughts. All the negative thoughts should be filtered out from whatever you're thinking. Because at the end of the day, everything is in your mind. Some random person will come up to you and say, the pass percentage last time was just 10%. I don't even think you can pass in your first attempt. Don't be in touch with such kind of people because at the end of the day, it's you who can make a change, not anybody else. Everybody has a mouth, they will yap around, but everything is in your mind. So do not let your mind fool you at this point of time. I would suggest you to jot down your daily activities on a piece of paper or diary, whichever is more comfortable. Have an account of every single activity you do in your day, how long you spend your time on certain activities, maybe TV time or lunch, dinner. It shouldn't exceed more than 30 minutes or 20 minutes. It's totally up to you if you can manage your entire day. What I would suggest is that cut down on your leisure time in case you're going overboard. The minute you tend to be more accountable, that's when you can execute your plan efficiently. Make sure you follow a Pomodoro session, 50 minutes, 10-minute break, or 55 minutes, 5-minute break, 2 hours, 15 minutes break. It's totally up to you. It varies from person to person. I used to do 1.5 hours with 20-minute break. Sometimes it used to be 2 hours and 20-minute break. So it's totally up to you guys. In a day, I used to study for at least 14 to 16 hours. Minimum 12 hours I had to study. I used to put in that efforts. So it's totally, again, it varies from person to person. Some people can finish their work within 8 hours of laser focused studying, but I needed 12 to 14 hours. So you guys don't have to follow anybody over here. It totally depends on your body type. It's not about how long you spend on studying. It's about how efficient you are while studying. That makes a difference. There's no point studying for 2 hours and you just absorb 20% of the content. If you're studying for 2 hours, make sure you're absorbing every single thing you've studied, because that makes a difference. Have a fixed routine and do not make excuses. Lead a disciplined life. It's important because you will see a huge difference in your scores once you start leading a disciplined life. When everything is in order and you start executing, you will sleep better in the night. There's a lot of misconception that the lesser you sleep, you'll be more productive because you'll have more time to study. No, we all are doctors and you all know how it works. Do not mess up with your NREM and REM sleep cycle. It is not a good thing. I would suggest you all to sleep for at least 6 to 7 hours every single day and not less than that. 6 hours minimum should be there. You all need brain rest. And make sure you sleep in one go and not 3 hours in the morning, 3 hours in the afternoon or something like that. Make sure it's a 6-hour sleep from 12 to 6 or 1 to 7 in the morning. It's totally up to you. Do not be awake all night just to sit and study. You know, you can't be very efficient, but again, it's your personal choice. Whenever you sleep, make sure it's a 6 to 7 hours in a stretch and not with breaks. Apart from this, the few things I would want you to consider and execute it. 1, 10 minutes of brisk walking every single day. You need fresh air. You can't be sitting in your room all day trying to be productive. It doesn't work. I learned this in a hard way, so I would request you all to actually get out of your room for 10 minutes every day. Go out, step outside, walk 10 minutes, come back. You will see the difference. So that's one thing I would want you all to follow. I would also want you to spend 20 to 25 minutes of your life every single day with your family. The amount of strength you get when you talk to them, the emotional support system you get from them, it is very important. I've already reiterated this fact that everybody is vulnerable at this point of time. So you need an strong emotional support system which comes from family. Without them, for me, I wouldn't have even cleared this exam. Probably I wouldn't have even returned this exam. This helped me a lot. So I would suggest you all to do it. The last thing is that eat healthy food. Avoid junk food. Try to eat a lot of dry fruits like almonds, cashews, pista, walnuts, whatever you like. Make sure you eat almonds if not for anything else. You know the science behind it. Aim for 200 plus and not just 150. I know we all require only 150 to clear this exam. When you aim for 200 plus, you will prepare accordingly. You will put in twice the amount of efforts than required. So I would suggest you all to prepare for 200 plus and not just 150. I understand that the score doesn't matter as long as you pass. Out of personal experience, when you score above 200, it gives you immense confidence that you have cleared an exam which is very difficult, which is equivalent to NEET PG now. So that is a great feeling. So it boosts your confidence level, your self-esteem, everything. I hope this video helped you and you found it informative. Please like, share and subscribe and hit the bell icon for more notifications. I am always there for you. You can always DM me on Instagram or leave your comments in the comment section below. I will be linking all important Telegram groups which I used for my preparation down below in the description box. In case of any query, please feel free to ask me. I'm always here for you. Meanwhile, stay happy, stay healthy and ಧನ್ಯವಾದಗಳು.